I basically was very happy with the performance of the Mammotome over all those years and really had no reason to change to a different device. And as I said, I certainly tried a variety of other devices, which all I thought worked well, and some may have had one or two slight advantages over the Mammotome in certain areas, but maybe in other areas didn't, so I basically never felt compelled to change. And basically what sold me on the Eviva was that it actually, to my surprise really, lived up to all the hype that had preceded it, which is, I think, not necessarily common in this field. I think we hear a lot of things that are going to be the latest, greatest, best thing we've ever seen, and they either never make it to market, or even if they do, they turn out not to be what they were described as. After 2 cases, I walked out of the room, probably after the first case, but I did the second case just to solidify my my instincts. But I basically walked out and said to Josh, right, how soon can I get a box of these, and when can we make this transition? Some of the main features, I think, that really make it a device that is worth investigating and using. First of all, the way the device fires when you are in your pre-fire position and you advance the needle to take your samples and fire the needle, the device doesn't really make virtually makes no sound, or a very soft kind of a puff of air, almost a hydraulic kind of sound as it's advancing. I don't think I've had a patient react even in the least bit when we fire the needle. So that's a major improvement right off the bat. The next feature I think that's really key is the lidocaine infusion during the procedure. I don't know the number of procedures we've done thus far. We've started sometime in, I guess, December, so we've been doing it for about 6 months with the Eviva, and so on average, we've probably done at least 50 or so stereo procedures by now, and I can't think of a single patient that has experienced any pain during the acquisition of the samples since we've been using this device. And I think that certainly has most to do with the fact that the lidocaine is injected into the cavity during the acquisition of samples, and also the mechanism by which that works, the fact that it's kind of sprayed into the cavity kind of in a radial pattern. It really covers all the area necessary to anesthetize the tissue. So that's been a dramatic number one improvement for the patients, and also improvement as far as our performance of the procedure and the time it takes with which to perform the procedure. The addition of the tubing between the device and the specimen basket, which allows you to visualize the specimens as they're passing through the needle into the collection chamber, I think is an improvement over the previous ATEC device, where it just went directly into the basket. You can easily see the samples as they're being acquired, passing into the collection chamber, and you can assess how well the samples are being obtained and what they look like, at least reasonably well enough to know that you're getting good samples. I think probably the biggest, the most significant feature that I think makes this device the one to go with is the speed with which you can now perform the procedure. As I mentioned, the lidocaine issue took away a lot of the delay, but even without that, just the ability to acquire specimens quickly, again, because they're being brought back into the collection chamber, you don't have to stop each time, have the technologist or your assistant remove the specimen from the area where it comes back, and that can sometimes take several seconds, 30 seconds, even depending on how difficult it is and what the sample size is and where the positioning of the device is relative to the assistant. All takes time. With the Eviva, I keep my foot on the foot pedal. I don't release it. It beeps, I turn. It beeps, I turn, and literally in less than a minute, I can acquire all my samples. And I usually still take 12 samples. I basically go around the clock face twice. So I'm taking 12 samples, and again, literally, it's less than a minute total time, I think. So for a lot of those reasons that I've mentioned already, the fact that there's less pain, that there's no loud noises, and that the procedure takes less time, those are all significant benefits not only for the physician performing the procedure, not only for the technologists involved and for the room turnover, but certainly for the patient. They're laying on the table for a shorter period of time. They're not experiencing any pain or as much pain, and not being startled at any point. So I think overall, it's just, for all those reasons, it's just a much better procedure because of the Eviva device. In addition, the placement of the clip is very easy. There's no dial back or pull back, not that that takes very long, but it's just another step that you have to remember. And I think for all of those reasons, I am a very strong believer, as I said, in the Eviva, and now not only routinely use it in my practice, but swear by it. But again, even when I'm extremely happy with something, if something comes along that I think makes a significant clinical impact, I will be willing to evaluate it and switch to it, and that's exactly what happened here.